Thyroid treatment success number 12, brain function. Brain function is extremely important in treating the thyroid, as I've mentioned previously in other secrets. The brain controls every bodily function. Your pituitary drives the thyroid gland. It releases TSH. The part of your brain called the hypothalamus drives the pituitary. Our brain needs two things to survive: fuel and activation. Fuel is oxygen, which is why we use exercise with oxygen therapy in our office, and glucose. We have addressed the glucose end of the equation, so let's address the importance of oxygen. As you age, your ability to utilize oxygen decreases by 1% per year each year after the age of 25. If you are 50 years old, you've lost 25% of your ability to utilize oxygen in your body. It's called oxidative phosphorylation, which is a big fancy $3 term meaning you're not using oxygen as well as you did when you were younger. Again, this is why we do exercise with oxygen therapy, or EWOT, in our office. Secondly, serotonin plays a major factor in thyroid function. There's a place in your brain called the hypothalamus, and there's something called the paraventricular nucleus. I know these are big fancy $3 words, but it's critical that you know this is if you're suffering with thyroid symptoms. The hypothalamic paraventricular nucleus is acted upon by serotonin and in the central nervous system, and what it will do is make you have low thyroid stimulating hormone, or low TSH. Taking thyroid hormones for these problems is not going to do anything for you. In fact, it will most likely make your symptoms worse. Don't get me wrong, I'm not saying to stop taking your medication. That's called practicing medicine without a license. But be aware of what is happening to your body. I am saying be aware of what's happening to your body, because once you start asking medical doctors why you're taking these medications, they're going to look at you like you're crazy, like you have a psychosomatic illness, which means it's all in your head, and the only thing you need is an antidepressant. The biggest influence on serotonin is blood sugar. That's why we just addressed glucose in thyroid treatment success number 11. So it's as vitally important if you're hypoglycemic or insulin resistant or diabetic that you maintain normal blood sugar levels. That's why it's important to eat healthy. Don't skip meals. Quit eating junk food. Every time you're eating junk food, you're literally eating away at your thyroid, and you're making your problem worse. By consuming a poor junk food-filled diet, you will increase your thyroid symptoms as feeling tired or sluggish, or inability to lose weight, or cold hands or feet, or insomnia. You will gain weight easily. You have difficult, infrequent bowel movements. You're depressed. You have lack of motivation. You have morning headaches that wear off later on in the day. The outer third of your eyebrows getting thin. You have dryness of the skin or scalp. You have mental sluggishness. You're nervous. You're emotional, and you have night sweats. You have all these symptoms, and yet your labs are quote-unquote normal in the eyes of your medical doctor. Remember, those labs need to be within the optimal or functional range. Don't suffer another minute. Call our office at 336-229-4226 and schedule 2 free visits with Dr. Naylor. Call now. Space is limited.